The number of unique Kentuckians vaccinated at this point, 1,867,037, which leads us to Dr. Kevin Cavanaugh, retired physician and also founder of a national organization called Health Watch USA. Good morning, Dr. Cavanaugh.
Good morning, Jack.
So how do you react to these latest figures out of Frankfurt?
Well, I think the figures are good. It is still showing a small decline, which that's going in the right direction. I, for one, though, still think we need to be a little bit vigilant. Remember, we may have variants. Not everybody's immunology can handle the virus. We do have immunosuppressed individuals, and we want to make sure that we also guard them. So certainly we're going in the right direction, but I think we still need to be a little cautious. And I'll be honest with you, all this talk about, well, it's summer and the virus is going to go away with the warm weather, we kind of heard that last year. And really last year, that's, I think, our organization's biggest failing, in that we predicted the virus would go away during the summer. And as you know, it surged. So I don't think we should count on the summer weather of being a for sure mechanism of suppressing the virus. I think we need to get vaccinated, and we need to go out and obey public health advice. And the thing that I'm following more than the number of infections is the number of vaccinations. And it is crucial in Kentucky that everybody get vaccinated, because with these variants, we're not going to be able to identify or snuff them out if they come into Kentucky if we're still having a high caseload of the wild type of virus, because our case trackers and healthcare systems will still be overrun. I mean, they have more cases now, even at our current level, than what I feel they can go out and adequately investigate. So let's get this virus under control so we can get back to a safe society.
And we don't play gotcha, and we don't play I told you so on this show, but we told you so. Talk about the CDC's recognition of, however you pronounce it, aerosolization.
Yes, and that came on Friday.
Yeah.
Yes.
But you had...
Yeah, that came on Friday.
You talked about that some time back.
Correct. We talked about this back last year, as early as August, with opening of schools, that all the data we were seeing in the case reports that this virus can aerosolize. The CDC finally came out on Friday and stated that aerosolization can occur and that the SARS-CoV virus can spread farther than 6 feet, especially in an indoor, poorly ventilated setting. Now, we talked about this Friday morning before the CDC report, and one of the things I think should be contingent on businesses reopening to a level that they have had before is that they have improved ventilation. They have improved air circulation and air sanitization so that we can get back to normal more safely. That's just key in our schools, in our businesses, everywhere. And also there should be an expanded use of N95 masks for these smaller particles. And so that is key. Now, I should add that we're not talking about necessarily the extremely small particles, but they're kind of particles in the middle between what used to be thought would aerosolize and what was thought to be just droplet spread. These particles are a bit bigger but can still aerosolize, and that's one of the reasons why masks are so efficient at defeating these types of particles in their spread. It's also why I think you still need to be a little bit careful outdoors, because within 6 feet where you have droplet spread of large particles, you can still get infected. The air won't dissipate this outdoors if it's the larger particles. Outdoors, it is very much safer because it dissipates aerosols. In other words, these little particles that will gather in buildings float away outdoors. But still up close, there could be a danger. And again, that's why you should get vaccinated. It is absolutely key to staying safe.
We always enjoy talking to you, sir. Thank you very much, and we will be visiting with you again on Wednesday.
Okay, thank you very much, Jack.